I think that's changed a lot. I mean, I'm a hematopathologist by training, and so when I started training, these diagnostic issues were definitely at the forefront of how we thought about MDS. The reality was, you can make the argument that it really didn't matter because we have so limited number of options when it comes to how we treat patients. And there was also this idea that MDS is this heterogeneous set of diseases. It's a syndrome, right, without a known cause. Well, that's already changed. One argument could be that it should no longer be called myelodysplastic syndrome, but myeloplastic disease, or even call the specific subtypes just by name instead of grouping them all together. But I think the oncology genomics revolution doesn't make people feel so insecure when it comes to the diagnosis of MDS. I think that's one thing that has been changing over the last few years and is going to continue to change. As a pathologist trained to look at cells on a slide, I think that will not change. It will continue to be very difficult to make diagnoses solely on that basis. But between genomics and flow cytometry-based tests and cytogenetics, I feel fairly comfortable that in the next few years we'll be able to. I don't think that the diagnosis of MDS will continue to be a problem. I think what will be the problem is, what do you do with these patients? And the heterogeneity in MDS is no greater than the heterogeneity in acute myeloid leukemia. And so this old paradigm, like MDS is a completely different type of disease, we have no idea of how to approach it, I think those days are gone. And that's why many more people are getting involved in MDS research, because now they have ways to think about disease and test hypotheses.